A special COVID card designed to help with contact tracing will be trialled on a small group of people in Rotorua. The government says the card, developed in conjunction with Otago Univeristy and initially tested with the Nelson Marlborough DHB, has some merit and worked under, quote, controlled conditions. New advice on mask wearing was also unveiled today. The Health Minister would like you to put one on should we move to level 2 again at any point. And Chris Hipkins joins me now. Minister, I want to get to the masks shortly, but let's start with the card first. And in simple terms that even I can understand, how does it work?
Well, the COVID card is it's either a card or a dongle or something that you wear on your person. So most likely you wear it around your neck. And when you come into contact with other people who are wearing one, each of your cards will record that you've been in contact with that person. So it's a good way of collecting data about who you've been into contact with without necessarily tracking all of your movements. And it means that if you need to contact trace who you've been into contact with, if everyone else that you've been into contact with has been wearing one, then actually you've got quite a good record there. So we're trialling it. We're going to look at, how well it works and, what the potential is for us to use it if we need to in the future.
Okay, so here's the thing. As you've described that to us right now, you really need the card to be widely used to be effective, because if I'm just wearing the dongle, nobody else in my office is, then you get a patchy read on my contacts, don't you?
Yeah, so that's one of the things that they'll have the opportunity to explore through the trial. How do people respond to it? Do they wear it all of the time? Do they find that it's actually a bit of a nuisance to wear and therefore they stop wearing it? Those are the sorts of things that they can work their way through during the trial period.
But even if the trial period works out, in order for it to be useful on a larger scale, won't you need a significant number of people to take it up?
That's right. So, for it to be very useful, yes, it would need to have a fairly high rate of take-up. And that's one of the reasons why we're trialling it rather than, doing it, because obviously to provide one to everybody is a very large cost. And we would only do that if we were confident that it was going to work. So we do need to work our way through, finding out what the strengths and weaknesses of it are before we made a decision about whether to deploy it more widely. Will
it interact with the app in any way?
Look, all of these things are tools. So the most, our contact tracing still relies on manual contact tracing through call centres, and that's always going to be the case. What the COVID card and what the app do provide better data to speed up that process.
But they won't be an integrated system in any way. The card, or the dongle as you call it, and the app will be two separate self-contained systems.
The trial at the moment doesn't link the two, that's right.
Okay, so the trial group in Rotorua, it's about 250 to 300 people. In general terms, who are they? Are they workers who work in the same place? There must be people who come in contact with each other, are they?
So that hasn't been finalised yet. That group hasn't been selected. We did want people to know that we're going to be doing a trial. We're getting a lot of questions about that, as you can imagine. And also we want people to know that when they see people out there, potentially wearing them, that they'll know what's going on. But there are still a few final details that are being worked through.
Okay, so what's the cost of the trial?
Overall, the trial's about $1 million. That includes the development that sits behind that. The cost, if we decided to go ahead with it, would be a magnitude many, many times more than that. So it's the reason why the trial is very, very important.
So what are the hooks with this? Because in your press statement, it said it works under controlled conditions. So what do you mean by that?
Well, the key thing about a trial is that you try all sorts of different things. So if people are being, if it's a conscious exercise, then people are more likely to be using it well, in controlled environment. On the other hand, what we've got to test and what we're trialling through this field trial is what happens if you give people the card and it's over a period of time. You can see how human behaviour might change over time as well. So
you mean you give them free choice? Free choice makes the difference in how this works?
To some extent, yes, that's right.
Okay. Let's move on to masks. So you gave some new advice today about wearing masks. Should we escalate to level 2 again? you would like us to have masks ready and waiting and to wear them when we're around others, like travelling on buses. So why are you giving that advice now, and why would you suggest we do it at level 2? Because at that level, there is no community transmission, according to the published levels as they stand.
So at level 2, there's obviously a higher level of risk than there is at level 1. At level 1, we've no community transmission. In fact, there's no evidence of COVID-19 being out in the community. The only evidence we've got of COVID-19 at the moment is in our managed isolation facilities. On the other hand, when we get to level 2, there would be evidence of COVID-19 in the community, though it would be small numbers of cases, and therefore enhanced precautionary measures would help us to keep it that way. So help us to stop there being any further widespread spread of it. We want to do everything we can to avoid having to go to level 3 or level 4.
The thing is, National has raised some concerns about this, saying it doesn't add up. You would have seen the press statement. Why announce this now, they say, when there are a few cases? What do these guys know that they are not telling us? So is it scaremongering on your part?
No, look, there's no great conspiracy theory here. I think all political leaders who are being responsible, I know we're in the midst of an election campaign, or a campaign's just kicking off, but I would hope that all political leaders could at least unite behind the fact that we all need to be prepared for future events. And we don't know what they may be. That's the nature of something like a virus. You don't quite know what's going to happen next. And so you have to be prepared. And I think, the responsible thing for all political leaders to do really is to encourage New Zealanders to be vigilant and to be ready.
On the flip side of that, it is an election campaign. So is it beneficial for Labour's election campaign for voters to be reminded that we're in the middle of a crisis?
I don't think they need us to remind them. I think anybody who turns on the TV news at night...
But is it part of your election campaign strategy?
No, it's actually part of our responsibility as a government. We have to govern right up to election day, and we have to continue to respond to COVID-19. COVID-19, is rampant around the rest of the world, and so we cannot take 6 weeks off from our efforts there and say, right, we're on the campaign trail, we'll worry about this again after the election. We have to remain vigilant, and we've got to remain doing our jobs around this right up to election day.
The return of community transmission is inevitable in New Zealand, according to the Director-General of Health. Is he wrong?
I think what the Director-General is saying is that New Zealanders need to be prepared for every eventuality, including...
What he was saying was that it was inevitable. So do you disagree with that? And are you questioning his professional judgment there?
Well, no, what I am saying is we are doing everything we can as a government to avoid a situation where we have widespread community transmission again. But we're also saying to New Zealanders, as is the Director-General, that we need to be prepared for what we would do if we did get to that point.
So do you think it's inevitable like he does?
Look, I don't have a crystal ball. What I'm saying is we're doing everything we can to stop COVID-19 coming across the border, to continue to do testing and contact tracing within the community so that we're stamping out any COVID, we're identifying and stamping out any COVID-19 where it might pop up in the community. We'll do everything we can to avoid there being further outbreaks, but we always need to be prepared.
That is his professional judgment, so are you not backing him in that assertion?
No, that's not what I'm saying at all. I think him and I actually have much the same message here, which is that everyone needs to be vigilant. We can't take for granted what we've achieved over the last 6 months. We've got to keep working at it.
Appreciate your time this evening. That is the Health Minister, Chris Hipkins.